Hello everyone, my name is Vesi and today I'm going to be talking about compartment syndrome. So first, I would like us to understand that our muscles in our limbs, our hands and our legs are in bundles. So every bundle is separated by a fascia. So within this fascia there is pressure. So normally there's pressure within our muscles, and when this pressure becomes too much, there's going to be swelling and blood flow will not be proper. So this is called the compartment syndrome. So there are two types of compartment syndrome. We have the acute compartment syndrome and the chronic compartment syndrome. So firstly, the acute compartment syndrome, this requires a medical emergency, and if there's no immediate action, there will be a permanent damage to the muscles and the nerves around that area. So this happens usually when there's a fracture in the bone. This also happens when there's a cast around a muscle that is swelling. So due to the fact that the cast is pressing upon the muscle which is trying to expand, there's going to be swelling within the fascias of the muscle. So the pressure within the muscle is going to be higher and there's no space for the muscle to swell more. So the cast is pressing on the muscle, which leads to compartment syndrome too. Then the chronic compartment syndrome, this happens gradually during exercising, when you're doing a continuous action like running, cycling. Let's just say it's like muscle pull. So it's not something that requires medical emergency and it doesn't cause permanent damage to the muscles. So what are the symptoms of compartment syndrome? First, in the acute type of compartment syndrome, the person feels more pain. So the person is also going to have a tingling or burning sensation. Also, the temperature on that limb is going to be very cold because there is no enough flow of blood around the limb. So blood is not flowing and the nerves and the muscles are all packed together. So for the chronic compartment syndrome, this one is not, it doesn't require medical emergency. So if you want, the symptoms are just like tingling, you might feel numbness, it's like a muscle pull, so it's not really serious. So now for the treatment, so the treatment for acute is different from the treatment for chronic. The treatment for acute compartment syndrome is usually by surgery, which is called fasciotomy. So you just make an incision within the fascia to release the pressure. It's just like there's a water in a balloon and you burst the balloon for all the water to come out. So you just make an incision and all the pressure comes out, and then it's the surgeon will close it back by a skin graft. Well, for chronic compartment syndrome, to relieve the pain, the treatment is just to stop the action, since it happens when you are cycling or when you are running or walking. So when you stop the action, you might have immediate relief, or sometimes you might need physiotherapy. Thank you.